Hello, I have the disease gangrene, which is caused by Clostridium perfringens. It can be caused by an infection when it develops deep inside the body and bacteria responsible starts releasing gas. As I previously said, the bacteria that causes a gangrene is Clostridium perfringens, and in some cases can be caused by a Group A Streptococcus bacteria. It can occur anywhere in the body, but most commonly affects the legs and the arms, or the outer extremities. Gangrene can be cultured from the fluid of a wound, and in some cases, surgery or a biopsy is performed to obtain a tissue sample. The fluids and tissues are then examined under a microscope to identify any potential clostridium that may be affecting the area. And then the bacteria can be cultured in the lab where it can be grown. C. perfringens is a gram-positive anaerobic spore-forming bacterium. It normally exists in a vegetative cell or in its dormant spore form. These spores produce toxins and enzymes, and growth of C. perfringens increases when nitrate is present due to substrate level phosphorylation. It also carries out glycolysis and glycogen metabolism. You can get gangrene at the site of trauma or a recent surgical wound. It develops when the blood flow to body tissues is interrupted and bacteria gets into the wound. Individuals can be more at risk if they have blood vessel disease, diabetes, or colon cancer, because this puts you at a higher risk to develop sores and other things on your body, which can have more bacteria get into your tissues. Most symptoms of gangrene develop 6 to 48 hours after the initial infection. These symptoms include vomiting, fever, increased heart rate, excessive sweating, pale skin that quickly turns gray, dark red, purple, or black, swelling in the area or around the wound, air under the skin, pain in the area around a wound, blisters with foul-smelling discharge, and yellowing skin and eyes. All of these symptoms are to gangrene, but I wouldn't, if you have vomit, you wouldn't think that you have gangrene. You have to look at all the symptoms. Gangrene can be identified by an examination and varied diagnostic tests that include skin cultures, blood tests for an abnormally high white blood cell count, imaging tests to visualize tissues and check for the presence of gas, and even surgery. It can be treated, once identified, by antibiotics administered intravenously, surgical removal, skin grafts, amputation of a limb, and hyperbaric oxygen to speed up the healing process. To prevent gangrene, you can follow these lifestyle changes, which are to avoid any tobacco products, properly care for any existing health conditions that can lower the risk for contracting gangrene, maintaining healthy weight by diet and exercise. I hope you enjoyed this presentation. Thank you.